Virginia, thank you so much for joining us today.
Hi, Michael. How are you?
So good. It's great to talk to you as always. It's interesting. I think I know the subject we're going to talk about, given your title at Roche as industry collaboration, and that's what your focus is. But I think we ought to talk about what collaboration means first. That's one of those open buzzwords, and it sounds relatively simple and easy, and it's really anything but. But what does collaboration vis-a-vis clinical trials in this industry mean to you?
Yeah, you're exactly right, Michael. It can mean a lot of different things to a lot of different people, but how I define an industry collaboration is when multiple pharma companies are working together collaboratively in a non-competitive way, kind of pre-asset, you can think about it that way, and often with other partners such as vendors, technology partners, CROs, patient groups, health authorities, and we're all working together to try and improve clinical trials for all of us.
And as you know, even better than I do, there are more and more trials. Trials are getting more complicated. We have an industry turn, there's turnover, there's churn, there's the PI one and done. This industry is facing a lot of challenges. Now more than ever, we need this kind of industry collaboration. It sounds obvious, yet there are barriers to it. Why is it? What are some of the obstacles to improving industry collaboration?
I think that we as an industry have really come a long way in the past 10 to 15 years about just being open to working together. I think now it is quite common practice to join these types of industry collaborations where we're focusing on harmonizing or standardizing to try and solve these types of problems, these big challenges, exactly like you're stating in drug development. What is the tricky part at this point is actually using the solutions that are coming out of these many different industry collaborations. We have no shortage of collaborations. We have no shortage of subject matter experts, passionate people who are willing to roll up their sleeves and get this work done. What we do have trouble with is adopting these solutions into our very complicated businesses.
It's an implementation issue, right? So, I mean, talk about some ways you think that you might, as part of this, as a leader, as a thought leader in this area, how might we advance this? How might we roll up our sleeves, if you will, and begin to implement a lot of these great ideas that come out of these think tanks and other organizations?
Well, I think, as leaders in this space, Michael, it is really incumbent upon all of us to learn this landscape of industry collaboration solutions. There are so many good tools out there. We have great resources from the Clinical Trials Transformation Initiative, from Transcelerate, from the Innovative Medicines Initiative, and now Innovative Health Initiative in Europe. I can keep going on and on. Many different tools that are available to us right now, and mostly for free. But we need to learn this landscape. There are many ways that we can start to address the challenges of bringing these collaboration solutions in-house. I would say first and foremost, we need to sell the idea to our senior leadership. And look, use whatever argument works in your organization. If that's an ROI analysis, if that's an ethics argument, if that is an ease of operation, maybe your company is looking for a particular solution and you're starting to create that in-house and you say, hold on a sec, I think this already exists. Bring that in, show that to these teams. That's a great first step.
Now, I love your optimism, and I love hearing you say you think we're in a better place than we've been in the last, or in the last, over the last 5 or 10, 15 years. It's nice to hear that. And I would say I've observed that myself. But let's talk about, before I let you go, looking ahead the next 5 years or so, what does success look like to you? How will this benefit? If we do this right, how will the industry benefit? And patients, most importantly.
Yeah, so what I would really like to see over the next 5 or 10 years, Michael, is for companies who are involved in these types of collaborations to really put some skin in the game. Don't co-create. Don't say, oh, I've joined this industry collaboration work stream and simultaneously in parallel create your own solution in-house. Why? You're double paying, both in terms of money and time and resources. Just go ahead and work on the industry collaboration solution created with this great wisdom of crowds approach, and then use it once you've created it, right? Don't create your own innovation teams without scanning this environment to see what's already available. And these solutions are created with a patient in mind. Many of these collaborations have patients sitting at the table co-creating. This is the right thing to do for patients right now. So I really believe we all just need to pick up our heads and be a lot more open-minded and frankly diligent. Do the hard work, do the change management to bring these fantastic solutions in-house.
Fantastic. Great note to end on. Virginia, it is inspiring to talk to you. Thank you so much for what you're doing out there. You're really lifting clinical trials, and we all appreciate it.
Thank you, Michael.